So good afternoon. Today we're here to talk about our fiscal 22 budget proposal. But first I want to walk through some issues with respect to vaccines. Yesterday our administration was informed by the Biden-Harris administration that states should expect to receive additional vaccines soon. We're obviously pleased to learn that this information is coming from the federal government. We haven't received specific details on it yet about the actual size of the increase or the delivery schedule to the Commonwealth, but obviously we'll keep people informed on that as we become more informed. But in the meantime, we're going to plan ahead with the assumption that our new sites will be able to deliver over 300,000 doses each week by mid-February, and anticipate that at some point we'll get more guidance from the feds about just what exactly an increase in distribution would mean here in Massachusetts. The state's ability to vaccinate our residents will obviously depend on how much vaccine we get from the federal government and when, and suffice it to say, we'll move the doses when they arrive. Beginning on February 1st, adults over 75 will be eligible to start receiving vaccines, and today, appointments for those residents have started to become available online through the vaccination map. For more information, people can go to mass.gov COVID vaccine. Using the map, residents can click on vaccination sites that are convenient to them to schedule an appointment. We know that many folks and family members have a lot of questions on when they can get a vaccine. In addition to the website, our administration is working to create additional resources for residents to utilize to book their appointments, and is working with other public and private organizations that support our seniors across the Commonwealth. In the meantime, we would certainly urge family members and friends to help support older residents, help them book their appointments through that website if you can get that done for them. And this will not only be incredibly helpful to your loved ones, but it will also help older residents start securing appointments when they become available. We'll have more to share on this as we go forward, and we expect that by the start of Phase 2, there'll be a large number of residents trying to secure a limited number of appointments. If you can't secure an appointment right away, you need to be patient about that. We understand the difficulty that's attached to that, but keep checking the website and going back to check again on the sites that make the most sense for you. More and more time slots will be added on a rolling basis as we get additional supply. And I want to thank everybody again for their attention on this one and their patience. With respect to the FY22 budget, which we'll be filing later today, the proposal continues to make big investments in the Commonwealth and in the people of Massachusetts. Despite the significant fiscal challenges, our budget fully funds the landmark Student Opportunity Act, invests in our recovery, and leaves our rainy day fund at the same level it was at the year we took office, all without raising taxes on our residents. Over the past year, COVID-19's created numerous economic challenges. The Commonwealth's tax revenues have dropped significantly since the pandemic. Though not as badly as initially projected, the revenue picture remains somewhat unpredictable. Our new fiscal year 2022 tax revenue projections are basically about $1 billion less than the original projection for fiscal 21 that was announced pre-pandemic. Responding to this public health crisis has led to billions in unanticipated costs and expenses, and this includes using state and federal dollars for things like $1 billion through the Mass Health Program to help stabilize our healthcare providers, $60 million in field hospitals and isolation and quarantine hotels, $56 million to address food security issues, and another $41 million to purchase personal protective equipment. Our response is also being supported by the most recent federal COVID-19 legislation, which includes over $450 million for testing and tracing and nearly $90 million for vaccine distribution. Fortunately, due to our fiscally responsible budgeting over the past several years, Massachusetts was in a better position than many states to respond to the challenges that were created by the economic decline and the pandemic. Shortly after we took office, we faced $1 billion structural deficit, but the commitment that we in the legislature made to budget discipline and strong partnership has led to balanced budgets and surpluses for the past several years without raising taxes. And as a result of that, we tripled the size of the state's rainy day fund, which we've been using to prevent deep budget cuts or tax hikes on our residents during these challenging times. With this budget proposal, as I said, we would leave our rainy day fund at the same level it was at when we took office. Over the years, we've also worked to save money and run programs more efficiently, and that includes things like managing the costs for major cost drivers like Mass Health, which previously experienced double-digit year-over-year rate growth before we took office. In the 2 years before we arrived, Mass Health grew on a gross basis by an average of 12% each year. By contrast, its average rate of growth for the past 6 years has been just 4%. That fiscal discipline has allowed us to continue to invest in other priorities around education, public health, economic growth, and support for local communities. And today we're submitting a $46.4 billion budget recommendations to the legislature. The budget fully funds the first year of the landmark Student Opportunity Act, provides substantial resources to promote economic growth and development as we work to recover, and helps ensure that public health during a pandemic continues to be there for us, all without raising taxes. We don't believe raising taxes on the residents of the Commonwealth, especially in the midst of all that's going on, is the right thing to do. Some specific highlights. First, with respect to education, last year we worked closely with the legislature to provide a $108 million increase in Chapter 70 funding to support public K-12 schools across Massachusetts. Together with the significant federal dollars Massachusetts schools received, these total investments provided more resources for local schools than the initial fiscal 21 budget proposal we made funding the Student Opportunity Act. The budget proposal we're releasing today builds on those substantial investments, as I said, by fully funding the first year of the Student Opportunity Act. And in 2019, that law was something we were proud to work with the legislature on and sign, and it will result in significant resources for local schools as it's phased in over 7 years. We're keeping the commitment to local school districts by fully funding the first year, and while we were able to leverage federal dollars to provide significant resources last year, we look forward to being able to begin to build the base of implementing this law into our Chapter 70 formula and our budget process here in the Commonwealth. The budget also includes over $246 million in new funding related to the Student Opportunity Act, including nearly $198 million in new Chapter 70 funding with a particular focus on supporting school districts that serve low-income students. This means that this year the Commonwealth will be investing a total of $5.5 billion in our local public schools, and we're pleased to be able to make this historic investment in our students and our schools despite the challenging times. Additionally, our proposal would allow local cities and towns to count $114 million in federal support toward their Chapter 70 required local contribution. That would be in addition to our historic level of state support. That will help communities make their piece of this puzzle work in the next fiscal year. And to help schools operate safely during the pandemic, we facilitated access to over $1.3 billion in federal funding, which has been used to support a broad array of costs associated with alternative learning models, safely reopening, and maintaining school operations during and after the COVID-19 pandemic. Nearly $1 billion of this federal funding remains unspent between the approximately $800 million included in the latest federal bill, as well as previous CARES Act funding, which also remains available to school districts to spend going forward. Schools are also receiving state funding for public health tools like our pooled testing initiative and air purifiers. So far, the state's purchased and distributed equipment to about 95 school districts participating in that block purchasing initiative. We continue to believe, along with the science and health experts, that the best and safest place for students is in school. And we urge school districts to make full use of these funds and these resources to bring kids back to school for their emotional and educational development. We're also continuing to support the ongoing economic recovery that we need to pursue here in Massachusetts and foster development and opportunity. We recently signed the economic development legislation that provides about $626 million in capital authorization from the legislature to drive economic growth and improve housing production and stability over the next 5 years. We're also in the process of awarding $720 million to small businesses through our Small Business Grant Relief Program. That initiative is the largest grant program in the country to utilize COVID relief funds to support small businesses, and we've been focusing especially on industries and businesses that have been particularly hit hard by the pandemic, like restaurants and hospitality. We'll be announcing the next round of funding on this tomorrow. And the budget we're filing today complements these efforts with key resources to support workers and small businesses, including $4 million for additional technical assistance for entrepreneurs and small businesses, especially those owned by women, immigrants, veterans, and people of color, and $1 million for regional economic development grants, and $17 million to continue transforming our vocational high schools into career technical institutes. This was a very big initiative in last year's budget, which we managed to do on a much smaller basis than we originally anticipated because of the pandemic, but we continue to believe that the opportunity to link more directly what's going on in our vocational and technical schools with what's going on with our employers is a huge opportunity to not only create work opportunities for students, but also to create work opportunities for people who are looking to change careers or people who aren't actually able to go to a vocational technical school, but would be able to go after school to a voc tech school to learn a skill that they could then use to translate into work themselves. And we believe this program, fully implemented, could train as many as 20,000 new workers over the next several years in very high-paying and available job opportunities across the Commonwealth. This budget also continues our support for the recommendations that were made by our Black and Latino advisory commissions. It's a $30 million investment in education, job placement, and workforce training programs, because we recognize that an unequal impact of this virus has had on communities of color and the importance of promoting equity in this economic recovery. These investments are another step in that effort. On housing, the economic development bill also includes our housing choice legislation, as well as significant resources to increase housing options and production across the Commonwealth. And we look forward to working with local communities, local developers, and others to really make that sing. We've also launched, as people know, I believe, an eviction diversion initiative, which included $171 million to promote housing stability. And that program's already running. And in addition to that, we are about to receive about $450 million for rental assistance and eviction diversion support from the most recent federal COVID-19 bill, which should be a terrific asset as we continue to work on that. Together, those programs can all make a big difference in promoting housing stability here in Massachusetts and creating more housing opportunities as we go forward. The budget we're filing today builds on that and also includes $196 million for the emergency assistance for family shelter programs, $135 million for the Massachusetts Rental Voucher Program, $75 million for local housing authorities, and $55 million for homeless shelters for individuals. With respect to health care and substance misuse, in addition to recognizing the investments to address COVID-19 that we mentioned before, this budget also includes $79 million for Chapter 257 Human Service Provider funding, which is an update and a rate increase methodology that we implemented at the start of our administration. It was passed, let's just say, years before we took office, but never implemented by any administration. It was designed to make sure that private, nonprofit, human service, and social service providers were adequately reimbursed for the services that they provide. We are the first administration to implement this program, and we've implemented it every single year since we took office. That $79 million will be a terrific investment in organizations that, especially during the course of this pandemic, have looked after, taken care of, and supported some of the most vulnerable citizens we have here in the Commonwealth. We also have funding in there for new key public health positions at the state lab. Obviously, the state lab's been busy. We expect it will continue to be going forward. $10 million in grants to health departments to support municipal responses to COVID-19, and $20 million in new funding for the new DCF Congregate Care Network, which is a big part of how DCF looks after kids. The budget also preserves the pre-COVID-19 pandemic eligibility and benefit levels for social safety net programs, which has been a critical piece of how we've supported many residents and families in need over the course of the past year. This budget also makes continued investments in behavioral health and substance misuse disorder, which we know are incredibly important challenges that have been completely exacerbated by the pandemic. At Mass Health, our proposal includes $84 million to help reshape behavioral health in Massachusetts. The biggest thing it does is creates a front door for treatment, a new centralized service for people or their loved ones that they can call or text to get connected to mental health and addiction treatment. This is something that many of us have been hearing about for a very long time, and we believe this is an opportunity to create a real substantive front door for people, especially when they're in crisis. All in, our administration has increased state spending on behavioral health services by over $400 million over the past 4 years. Budget also includes a total investment of $357 million across a variety of state programs to combat substance misuse disorder. These investments represent a $22 million increase over the last fiscal year and continue our historic investments in combating the addiction crisis. That includes $943 million to the Department of Mental Health, including an effort to restructure the Children, Youth, and Family Intensive Community Service Program, which will allow more children to live at home with supports rather than congregate care settings. I just want to say thanks to the legislature and our colleagues in the administration for the collaborative efforts we've all put into fiscal discipline, which has bolstered our financial reserves and made it possible for us to make these investments and to continue to support local governments, to continue to support education, to continue to invest in a variety of human and social services that are especially important during this pandemic, while continuing to be able to do so without raising taxes on the Commonwealth's residents. We obviously remain committed to ensuring that the health and safety of all of our residents are addressed as we continue navigating the pandemic. And with that, I want to turn it over to the Lieutenant Governor, talk a little bit about how we're planning to support our municipalities as part of this.
Good afternoon. Thank you, Governor. And thank you to Secretary Heffernan and your team over at Administration and Finance. You've worked really hard on this budget, and we appreciate your dedication. This spending plan will continue to support communities and families throughout Massachusetts as we move forward with the COVID-19 recovery. It will also further strengthen our ongoing partnerships as we fund critical programs and municipal services. Our administration recognizes the important role local government plays in delivering essential services to our constituents. Consistent with previous budget proposals, we are proposing to increase unrestricted general government aid, or UGA, consistent with the projected 3.5% increase in tax revenue. This translates to a $39.5 million increase in UGA and a $1.168 billion total investment. We are making these substantial investments without raising taxes. In 2015, our administration launched the Community Compact Cabinet Program, which champions municipal interests across all executive secretariats and agencies and develops best practices for the state and municipalities. It's been an honor to work with our local officials on strengthening the way that they deliver services throughout the communities in our Commonwealth. And I do want to thank the legislature for their collaboration, their partnership, and their support for the Best Practices Program and our shared commitment to our municipalities. Today's proposal includes $4 million in funding for the community compact-related programs, including best practices and regionalization and efficiency grants. Additionally, the budget includes $4.8 million for the Public Safety Staffing Grant Program managed by the Executive Office of Public Safety, as well as $3 million for district local technical assistance. Our fiscal 22 budget proposal is another opportunity for the administration to continue our strong track record supporting public safety. We know that law enforcement and first responders throughout the Commonwealth face increasingly complex challenges, and it's very important to ensure transparency, trust, and accountability. This budget proposal it proposes significant criminal justice and public safety investments, including nearly $214 million for medical and mental health contract costs with the Department of Corrections, $61.8 million in reentry and diversion programs, and $11.3 million in funding for the Shannon Grant Program to fund anti-gang and youth violence prevention efforts. Our proposal includes $4.1 million for the Massachusetts Emergency Management Agency, which will help improve the state of readiness and support local communities need across our Commonwealth. MEMA has played a critical role during the COVID-19 pandemic, including PPE warehousing and distribution, did an incredible effort standing up and supporting food security efforts across our state. This funding will allow the agency to do more frequent and in-depth reviews on emergency management plans, increasing trainings and exercises, and staffing and warehouse critical commodities. The COVID-19 pandemic and the public health response measures, such as quarantining and social distancing, have created new challenges for survivors of domestic violence and sexual assault. As the chair of the Governor's Council addressing these issues, I understand how critical a priority this must be for our administration, and we are continued to work closely with community partners and local stakeholders to ensure that survivors and their families have access to services and supports necessary in times of crisis. Thank you for your ongoing efforts during these challenging months to support victims and survivors, all of you. This budget continues supporting these efforts with proposed investments of $96 million in total funding. This represents a 48% increase compared to fiscal year 15. The sexual assault domestic violence investments include $50.3 million in funding for DPH to carry out domestic violence and sexual assault prevention and survivor services and emergency and transitional residential services for victims and their children. It includes $6 million to support the SANE program, our sexual assault nurse examiners. It also supports $1 million focusing on promoting healthy relationships and preventing dating violence among youth and teens, amplifying the Respectfully campaign. I want to thank my colleagues in the legislature for your ongoing support for these initiatives. $1.7 million for DCF to meet the needs of families involved in domestic violence situations and the Sexual Abuse Intervention Network. $33.8 million for DHCD to provide shelter, services, and housing assistance for individuals and families who are victims of or at risk of domestic abuse at home. On behalf of our administration, we are so thankful to the community leaders and advocates for your tireless work and making sure that these individuals get the support and they help to be safe and supported in our Commonwealth. I would now like to turn it over to Secretary Heffernan.
Thank you, Lieutenant Governor. I first want to thank Governor Baker and Lieutenant Governor Polito for their leadership and guidance throughout the budget process, as always. I also want to recognize and thank my fellow cabinet secretaries and their budget teams for their extensive work and collaboration this year. And let me also highlight the incredible work of our Budget Director, Brand Shim, our Undersecretary, Catherine Hornby, Deputies Sophia Capone, Olivia Graham, Olivia McCaffrey, and Paul Chong, and our hardworking, as always, our hardworking and dedicated team of fiscal policy analysts. Additionally, our A&F legal team pulled double duty this year, with the legislative session ending in January, and I would like to thank them for their tireless and nearly round-the-clock work. As we all know too well, the COVID-19 pandemic created budgetary challenges and economic difficulties for states around the country, including decreased tax revenues, changing demands for government services, and unanticipated costs and expenditures. But here in Massachusetts, as the governor mentioned, we have been better prepared to deal with the pandemic than many other states, due in part to our administration's continued focus on fiscal responsibility. This administration has consistently worked collaboratively to control costs of programs such as Mass Health, build up our financial reserves, and maintain fiscal discipline. And our ability to navigate and respond to the challenges of COVID-19 has also been made possible by our strong partnership with the legislature. We are proud to work closely with our legislative colleagues, especially Ways and Means Chairs Aaron Mikowitz and Mike Rodricks, as well as their teams. We look forward to continuing this productive relationship as we move forward with adopting a final budget for '22. I'd now like to briefly mention some of the notable fiscal highlights. House 1 includes $45.6 billion in gross spending, a slight decrease, 0.7%, over fiscal '21. This spending level is driven primarily by caseload and cost decreases at Mass Health, which experienced cost increases in '21 related to the pandemic. Our budget is based on a $30.12 billion consensus tax revenue estimate, which anticipates a 3.5% growth in total tax collections over fiscal '21 revenues. House 1 still includes substantial investments while maintaining fiscal discipline as the Commonwealth begins to transition away from one-time revenue and spending increases that we needed to combat the pandemic. These one-time initiatives have utilized various state and federal resources both on and off budget. They help to ensure public health, address a variety of needs, both social and economic. Our budget proposal continues our commitment to funding critical priorities, such as encouraging economic growth and fully funding the first year of the Student Opportunity Act, while preserving substantial financial reserves for the future and without raising taxes on the Commonwealth's residents. House 1 authorizes a withdrawal of up to $1.6 billion from the Stabilization Fund, which would leave the fund with a balance of approximately $1.11 billion. This withdrawal would help ensure the continuation of essential government services and responsibly preserve financial reserves for fiscal 2023 and beyond. Working together with the legislature and the administration have been able to grow the Stabilization Fund pre-COVID more than threefold since 2015. This now enables us to face the budget challenges associated with COVID-19. It is also important to note that improvements in tax collections or new federal revenue sources would allow the amount of this Stabilization Fund withdrawal to be reduced. To promote continued fiscal stability and minimize risk to essential government services, House 1 recommends delaying the new charitable deduction until state budget is balanced without a withdrawal from the Stabilization Fund. House 1 also builds on the sales tax acceleration measures which were signed into law in December 2020. Our proposal further modernizes sales tax collections by requiring third-party payment processors to capture sales tax at the time of purchase and remit sales tax on credit cards and other electronic transactions daily. This initiative would not begin until 2024 and would be targeted towards some of the largest businesses operating in the Massachusetts. To continue supporting and assisting individuals with disabilities, we are again recommending the creation of a new disability employment tax credit for businesses that hire individuals with disabilities. This tax credit would be $2,000 per employee who work a minimum of 18 consecutive months. House 1 also incorporates the fiscal impact of legislation we are filing today, which would allow people in Massachusetts to wager on professional sports. Our proposal, as the Lieutenant Governor said, also provides significant support for key issues, including substance abuse and misuse, sexual assault and domestic violence, racial equality and diversity, children and families, transportation, and public safety. In closing, I would like to reiterate my deep appreciation for our consistently strong relationship with both the House and Senate Ways and Means. We look forward to working with our partners in the legislature to deliver a responsible fiscal plan for fiscal '22, and that both fund critical priorities and can continue to maintain fiscal discipline. Thank you.
Thanks, Mike, and tell your team, of course, how much we appreciate their work. We spent a lot of time on a lot of virtual conversations over the course of the past few months. Questions?
Governor, we're receiving dozens and dozens of phone calls about the vaccine rollout for people 75 and over. They're using words like frustrated and angry, that the process is very disjointed. Is it time, and they can't make appointments, is it time for a more centralized system or even some sort of a call center to get people in the queue?
I think the biggest challenge we're going to face on this rollout, and we said this several times, is if demand outstrips supply, which is where we're going to be for some period of time until the federal government can get to the point where their distribution to us reaches some level that's consistent with the number of people who are eligible to get vaccinated. This process for people will be frustrating, and I understand that, and I think we all appreciate that it's going to require a certain amount of patience for people to understand that it may take several trips to the website before they're going to be able to get an appointment. But as we said yesterday, we expect that as we build out the capacity here in Massachusetts, unless there is a big change in the federal distribution on this, we do expect that we're going to end up with more capacity than we have vaccine to serve, which will limit the number of appointments that can be made. And I made very clear yesterday in my remarks that there's a difference between capacity and supply. And this is going to be, I think, a challenge until we see a big change in the amount of vaccine that's coming, not just to Massachusetts, but to other states. I was on a call yesterday with the National Governors Association with members of the Biden and Harris administration's vaccine team, and one of the major sort of points of interest coming from governors generally was better visibility into the pipeline and better understanding about how much vaccine would be available and when, because this is going to be, for all intents and purposes, one of the greatest challenges we're all going to face until there's a significant increase in the amount of vaccine that's flowing through that system.
So, Governor, are you sort of a call center or something just to centralize this whole process? That seems to be a big part of the frustration.
I think we're working on whether or not there are other ways we can help people navigate this. But the other thing that's important for us to incorporate into this is making sure that our colleagues in local communities, which in many cases, especially for seniors, is where they go first, have the information they need to help them as well.
Governor, are you saying supply is the problem that is stopping people from getting appointments this morning? Is it that?
Well, keep in mind that is, first of all, many of the people who are probably in the appointments were people who booked those appointments before this morning. Because remember, there's still, I'm going to say 20,000 plus, there's still 20,000 first responders who are working their way through this process as well, in addition to the 75 and over population. So, this thing is a rolling rollout. It's not, you don't completely clean out. I think we talked about this yesterday as well. There are still people who are eligible to get vaccinated who are part of phase one who have not been vaccinated. You have home health workers and PCAs, personal care attendants, who are eligible to get vaccinated who haven't been vaccinated. There are first responders who are eligible to be vaccinated who haven't been vaccinated. There are folks over the age of 75 who are now eligible to start making appointments, but that's going to be through a process that also includes the folks who are part of phase one, many of whom have gotten vaccinated, okay, but many of whom are still working their way through the process. And in addition to that, you also have the folks who got their first dose, okay, as part of phase one, who are coming back to get their second dose. So that's one of the reasons why this is going to feel constrained for people, and one of the reasons why it will absolutely feel frustrating. And if we had more supply, that would make a difference. But we can only play with the supply we've got. And hopefully, as we build out our capacity to the point where we will have far more capacity than we anticipate we're going to have vaccine to schedule appointments, hopefully the vaccine piece will catch up.
It sounds like you're describing a backlog. Are you still going to be able to start with phase two on next Monday?
Yeah, people have made appointments.
Governor, we're happy to see President Biden announce that he's going to try to get you 3-week visibility going forward rather than one, and you believe it.
Well, first of all, this is the first meeting. This call with the NGA was the first call that the new administration had with governors. And And thankfully, they spent a good part of that conversation talking about the two things that have mattered the most to governors. Number one, what's the story with respect to visibility going forward? How many weeks can we actually plan on with some degree of certainty? They talked about developing a more consistent way of communicating that. And the second was saying that they believed they would be able to increase, starting next week, the amount of vaccine that people got each week. Both of those things would start to make a really big difference. And I don't think it's fair for me to say, after they've been in office for 8 days, how that's all going to play out. But they certainly had thought hard about the two things that we were talking to them about during the transition, which was this issue around more visibility than a week, and what would in fact be the points in time when we would start to see additional vaccine come through the pipeline.
How about in terms of I know you talk about the supply, but the plenty hearings, Senator Chandler said today that the website was ineffective, tweeted out this morning. Is the website the problem, though? Is there concerns with that in terms of people getting bumped off, not being able to schedule their appointments for the supply when it comes in? Are those concerns that you have, and is the website adequate for appropriate?
Well, I do know people were making appointments this morning, and people have made appointments on that site previously. I guess with respect to specific issues, those are hard for us to answer. I'll certainly have somebody reach out to Senator Chandler to find out what the particular issue was that was raised with her.
Governor, you said you're exploring ways to make these. What ways are you exploring? What possible? Is that through the website or other ways?
Well, the biggest way to make it easier is to have more sites and more seats and more vaccine. So goal number one is to continue to roll out and expand the number of available sites and the number of available slots. Goal number two is to get clarity from the feds about what an increase looks like and how soon we can incorporate that into the way we distribute on a prospective basis, because those would clearly deal with the primary concern people have, which is getting an appointment scheduled as soon as they can if they're eligible.
You had said you needed 25% more, and the Biden administration, I know they weren't terribly specific to you, but they had said 17%. What would that translate to here in Massachusetts?
Okay, so that's a really good question. The conversation we had with the administration was about a national number, right? But they said we should be careful about projecting that national adjustment onto our own states. Okay, so that's why in my remarks I said we're pleased that the administration's talked about expanding the amount of vaccine that states are going to get on a weekly basis, but that we haven't heard officially what that will mean for Massachusetts. So I'm hoping by tomorrow, certainly by Friday, we'll know what the answer to that is. But we don't. I don't know. I heard the same 17% number, but they made very clear to us, don't just assume that means you're going to get 17% of what you had.
Governor, just to clarify, are the appointments being made based on supply or on capacity? I know the other day you had said there's a big difference between.
Say again?
Are the appointments being made this morning and in the days coming, are they being made according to the supply or the capacity?
Well, those two things are related. I mean, obviously, supply is a big part of appointments, especially for first doses. But my point about capacity is you also have to have seats for people who are coming in to get a second dose, not just seats for people who are coming in to get a first dose. But my view is, at this point, we believe it won't be very long from now before we're going to have more capacity than we have supply, which would lead to a very, if people are frustrated, we'd be frustrated about this too. You'd have empty appointments that we wouldn't be able to fill because we wouldn't have vaccine to put people in those appointments.
Governor, we've heard of several cases of individuals who work in administrative capacities at hospitals or clinical settings that have, in some cases, even been working remotely, that have been able to get vaccines, people in their 20s and 30s even. And I'm just wondering, with vaccines still being in such scarce supply, are you considering maybe offering additional guidance to these institutions to maybe skip those people for now?
No, we've made very clear that we want hospital employees to be vaccinated, just like we want long-term care residents and staff to get vaccinated. The early part of phase one was COVID-facing, and that was where the hospital community went. But the rest of phase one, which we opened up, would make it possible for hospital employees generally to get vaccinated. And I think our view on that one is our hospitals are running pretty close to full. They have a lot on their plate between COVID and all the other things that are typically happening inside hospitals and inside emergency rooms at this time of year, and we want them to be fully staffed. I mean, we went through a period earlier in the fall where we had as many as 2,000 beds that went away because of hospital staffing issues. And those staffing issues don't just involve, the people who are on the ground, they involve other people as well. So our point of view, hospital folks should get vaccinated.
Even those in offices or administration not working in the ER?
Well, if they work for a hospital, I assume they have a role that matters with respect to the hospital's ability to be successful. Just like if somebody works in a long-term care facility or an assisted living facility or a senior housing operation, whether you're, working in the cafeteria, or you're working in food service, or you're working in administration or accounting, I mean, you matter with respect to that organization's ability to perform. And it's really important from our point of view that those folks who take care of the people who are most vulnerable to COVID, which would be people who are hospital level of care sick, or seniors who are in SNFs or assisted living or that type of thing, we want those places to be fully functioning.
Any updates on the new mass vaccination sites? Are they going to be able to offer appointments right on Friday, particularly the one in Springfield?
Say again?
Is the mass vaccination site that's going to open in Springfield on Friday, are they going to be able to offer appointments right on Friday, or is this shortage going to affect that?
They'll be getting a vaccine distribution as part of their opening. They will open, yeah.
They'll open on Friday?
I don't know the answer to that. I do know that they are in the, we'll get you the answer, but I don't know I don't know how the queue works with respect to them, but I know there's a shipment coming tomorrow. What I don't know about it is whether it's the same amount that we got last week or an increase based on what we were told. That would affect how much, but it wouldn't affect whether or not they would get it at all.
Governor, could you, you're the Secretary, explain the sports betting budget? What would that exactly look like if that were to pass into law?
I'll let Mike talk about that. But basically, it's basically the same framework that we filed at the start of the legislation 2 years ago. And I think the message we got from a bunch of folks in the legislature was this was something that they just weren't going to get to, given all the issues associated with COVID and everything else. But I do think it's something they want to take on in this legislative session for a lot of reasons, not the least of which is we now have a lot of experience with other states in the Northeast that are in the space, and it seems kind of inappropriate at this point for us not to be there as well. But do you want to talk to the? You gotta get behind that.
It's identical to what we filed 2 years ago. It does not include college sports. So it's professional sports only. But as the governor said, we want to start a conversation with the legislature and move the bill forward. If you look at what other states have done, particularly a state like New Jersey, it's become a significant revenue source to fund some really critical priorities. So.
Sorry, big switch. Using debit cards for the lottery. That's gambling related.
Cashless.
Yeah, cashless lottery. Why is that a necessary kind of?
If we've learned a number of lessons in COVID, and one is how quickly you can adopt to being a cashless society. And a debit card, again, is not credit; it's a cash substitute. So, taking the lottery and allowing them to have debit cards and cashless transactions is not gambling on credit. It's using modern technology to pay for lottery versus having to have actual cash in your pocket. So, and that's worth about $35 million, we think, conservatively.
Do you think Massachusetts is a danger of being left behind on this sports vote thing? If we don't have to get going?
I wouldn't say left behind, but I think as we watch other states progress, it makes it, the case is much more compelling that we should have sports gambling here in Massachusetts.
I mean, the dollar volume on this stuff is pretty significant, and I think the point I would make on it is you're seeing this happen in all the states that are around us, and there is a growing framework that most of these folks are working on. Because for the most part, these things start with a bunch of people doing a bunch of different things, and then once people get experience, everybody starts to move to something that looks like what you might call the common standard. And that's pretty much what's going on. And I just think for people in Massachusetts, why wouldn't we make this an available option the same way other things have been made an available option?
Should be legal to bet against the Celtics, right?
I would never bet against the Celtics, but I think I do think this thing is starting to mature, and I think it just makes sense for us to give our people the same chance to play that people have in other states.
Governor, you talked last night at the State of the Commonwealth of adjusting policy for like the new way of business, the future of work. I mean, your budget doesn't include any T&C fees, or does it include any policy adjusting for that? Or how much time do you think the state needs to reassess where sort of business stands before it starts shifting what we really make a policy?
Part of the reason I talked about the future of where and how we work in my remarks was because I've kind of been surprised by the divergence in points of view about this. There are a lot of people who talk about everything kind of going back to the way it was once everybody gets vaccinated. I actually don't think that's, based on the conversations I've had with people, I don't think that's what's going to happen. I think a lot of people and a lot of businesses have learned all sorts of things they didn't know about how they can conduct commerce over the course of the past year. And I think it has real consequences for downtowns. I think it has real consequences for housing. I think it has real consequences for transportation, and therefore, I think it has real consequences for us as we think about how we make investments as a Commonwealth to ensure that we continue to have vibrant downtowns, whatever that looks like, and the ability to support commerce. And I think Lieutenant Governor and I have talked a lot about this. I think we're going to probably try and get some really smart people, and we have tons of those in Massachusetts, together to help us do some forecasting on this. Because the consequences of getting this right are really good, and the consequences of getting this wrong are not. And I think this is something that, you get out a year or two from now, is really going to matter with respect to how our Commonwealth, and especially how our cities and towns, are proactively dealing with this. Now, maybe everything's going to go back and it's look exactly the way it was. And if that's what a whole bunch of smart people who studied this came away saying, fine, we'll lean into that. But I've talked to a lot of employers and a lot of people who are thinking very differently about how their future is going to work and what it's going to look like than they were before all this got started. And I just want to make sure we get this right.
Governor, could you set the record straight about the teachers' unions? They issued a statement saying your administration said that they claimed that they weren't going to go back to class until there were vaccines for children. Do you believe that's the case?
They want you to retract the statement.
The statement we made is accurate. We'll be happy to share with anybody who wants it the statement that our administration was responding to with respect to that. But the larger issue here is, we've put hundreds of millions of dollars, state and federal money, into supporting communities and school districts to make the investments that they need to make to help get kids back in school. And many school districts many private schools, many parochial schools located in all kinds of communities around the Commonwealth have pulled this off and successfully served kids in person since the fall, safely. We are also about to receive, as a Commonwealth, roughly $700 million that will go to cities and towns and school districts to be spent on making whatever additional investments people need to make to safely serve kids in school. And that will be alongside the Student Opportunity Act money that we're proposing, the $50 million that the legislature and the administration proposed in December when we did our budget, and the $170 million plus or minus that school districts currently have available to them from the last round of the COVID funding that they didn't spend yet. So what we really want more than anything, and we've created a pooled testing program with our colleagues in the lab community here to make it possible to do weekly COVID testing of both teachers, staff, and kids in communities across the Commonwealth that are willing to step up. And what I think I would say is we have put many resources in place. There are plenty of studies that have been done on this issue. The CDC just issued another one yesterday that schools, in-person schools, are not spreaders. And that the problems we're creating for kids, both emotionally and educationally, by not having them in school, is not insignificant. We've had pediatricians stand here and talk about what's happened to some of the kids that they look after and that they see over the course of the past 10 months. And I would just say, you know, there are funds available. There are programs available. There are people who have demonstrated this, teachers, staff, parents, and kids who have demonstrated that this can work. Can't we all just work together on behalf of the kids and give them what most of them are really hungry for, which is a chance to be in a classroom with their friends, with a teacher, face to face, the way it has worked in so many different places around the Commonwealth over the course of the past 9 months?
So are you disappointed in union leadership on this?
I think the science on this stuff is pretty clear. And I think the real world experience in Massachusetts for many school districts and for many schools is pretty clear. And I think a lot of the growing body of evidence that's coming out of all these studies that are being done, including the one the CDC released a couple of days ago, is pretty clear that in-person learning for kids is a pretty safe exercise if people do the things that we recommended and that many have implemented associated with masks, distance, hygiene, and all the rest.
Now, that raises the question we're hearing from parents with disabilities, kids who are taking care of their kids at home. They might see themselves higher up on the vaccination list because of that. And I don't know if that's thinking about something that can be done, et cetera.
So, can I get back to you on that one? That's not one as I sit here, I'd like to get back to you on that question. There are many, the vaccination list we developed came from a group, Michael Curry, who's the head of the Mass League of Community Health Centers and used to run the NAACP here in Boston, was here earlier in the week and was on the committee that established our priority list. And if he were here, I would probably turn that question over to him.
Would it be something you would think about doing? I mean, I know you don't have an answer for it right now, but it's something that you're thinking about, obviously, it's something you should think about.
I mean, we'll certainly take that to the committee and see what they have to say about it.
Governor, just one last question on the vaccine. New Hampshire, obviously Massachusetts and New Hampshire border each other. People live there, work in Massachusetts. They do have a centralized system for the vaccine. Why doesn't Massachusetts? Is it because it's a function of population, or why is it more complicated here than it is there?
Honestly, I don't know. I don't know. But I will see if we can get you an answer to that question.
Thanks, everyone.
Thanks, folks.
Governor, is the problem for people who can't, every time I look down at my phone, there's a new complaint from someone saying they can't get through, they can't get through. Is the problem supply? Is that the simple answer, that you're making appointments as you have supply? And there isn't?
I think there are 1 million people over the age of 75 in Massachusetts. We have gotten less than 1 million doses since this thing started in December. We've had more than 1 million hits on the state's website since this was announced on Tuesday. There's a lot of people here we're talking about at this point who are eligible and want to make an appointment, and we get that, and we're going to continue to expand our capacity. But if you have 1 million people who are eligible and you have only received 1 million doses since this all began in December, you are going to be constrained by supply. Thanks, everybody.